Robotic surgery was initially discovered and invented as a form of battlefield surgery by the US Department of Defense. However, this did not turn out to be a practical use, and it was adopted by medical professionals as one of the most advanced form of laparoscopic surgery. Patients often ask me, is it the robot who is performing the surgery, or are you actually doing it? The word robot actually means slave, and basically the robotic approach is one in which a surgeon sits at a console a few feet away, and the robotic instruments which are introduced into the patient's body are controlled directly by him using an advanced joystick with communication to the robotic instruments. So this allows us for multiple advantages for both the patient as well as the surgeon. So the robotic instruments have a wristed articulation which allows a 360-degree movement. This allows 7 degrees of freedom and is very useful, especially when we have to stitch organs together in small tight spaces, especially like the male pelvis where the prostate is located. Second, these are very slender instruments, so the incisions are very small, allowing for less infection, less pain, and a much better cosmetic appearance for the patient. The camera of the robot is also a 3-dimensional camera which allows an immersive field of view, so it's almost as if we are sitting on the organ of interest and operating. It's a magnified view, almost 10 times of normal, which allows us a very precise control, and we can cut what we need to while sparing the normal tissue, which improves the functional outcomes for the patient. Also, it is very ergonomically beneficial to the surgeon. He is sitting comfortably and operating and can do long and complex cases using this approach. For the patient, the blood loss is minimal. Blood transfusions are almost a thing of the past, especially for prostate surgeries using the robotic approach. The recovery is fast, the pain and cosmesis is much better, and it translates into a very precise surgery for the patient. Urology has been at the forefront of robotic surgery ever since its inception and approval by the FDA in 2001. Today, more than 20 or 30 million procedures have been performed using the Da Vinci robotic system, and there is really no incidence of failure of the robot or an inability to complete the surgery using the robotic technique. Today, almost all urologic cancers can be tackled using the robotic approach. Radical prostatectomy, which was a very formidable surgery when we did it with the open approach almost 20-25 years ago, has been completely revolutionized, and more than 90% of cases are done robotically today. It allows us a great anatomic visualization of the prostate. Suturing of the bladder to the urethra after removal of the prostate is very precise and very much possible even in the tight space of the male pelvis. This translates into better functional outcomes, reduced urinary leakage, and improved erectile function after surgery in these men. Partial and radical nephrectomy for kidney cancers are also done using the robotic approach, and the robot is truly the minimally invasive alternative to the traditional open surgery in these cases, without any compromise in cancer control, and allowing for maximal renal preservation in partial nephrectomy, and allowing us to do even complex and large tumors in a radical nephrectomy for kidney cancer. Other areas where the robot has been used in urologic cancer include retroperitoneal lymph node dissections in young men with testicular cancer, inguinal lymph node dissections for penile cancer, and in both these instances, because the incisions are smaller, the recovery and pain after surgery is much less for all men. Urinary bladder cancer is also tackled with the robotic approach. A radical cystectomy, which is done when the cancer invades the muscle of the bladder, was often done with the open approach. It has a high morbidity because it's a very major surgery. I was lucky enough to be a part of the first trial comparing robotic and open surgery for urinary bladder cancer during my fellowship in the US. And we found that with the robotic approach, the blood loss is almost half as compared to the open approach. Blood transfusions are minimal. The patient is discharged from the hospital much faster, and the survival of the patient and cancer control are absolutely equal in both the robotic and open approach. So patients who often have a fear that something will be left behind if we are doing the surgery robotically, they can rest assured that that is indeed not the case. So with the robotic approach, patients recover faster even after a major surgery like radical cystectomy for urinary bladder cancer. Today, robotic surgery has definitely revolutionized cancer surgeries, especially in the uro-oncologic space. It allows us a very precise approach and has multiple benefits for both the patient as well as the surgeon. If you liked this video and found it informative, please like and share and subscribe to my YouTube channel. Thank you.